We need to learn from the experience of those who use our services, so we were glad to hear from a former patient at the Whiteleaf Hospital in Aylesbury. Maybe glad isn't the right word, since her first encounter with the ward wasn't good enough. However, she reported that ward managers had listened to her suggestions for doing things better, and during a second admission had found improvements. Such feedback is vital. The board heard of various ways in which we're trying to get back on track. I won't say after COVID because the pandemic isn't over, but as we adapt. A trust like ours has to ensure staff are up to date on their knowledge, training and registrations, things that necessarily took second place during the heat of COVID. Now we're pushing hard on appraisals for clinical staff. One set of opportunities we want to open to all staff, nurses, speech therapists, dentists, as well as our doctors, lies in research, helping them step away from the front line and pursue studies that will bring better understanding of how the brain and mind function, of dementia, of how we might better organise community medicine and so on. We already work closely with the University of Oxford and Oxford Brookes, but we want to do more. It's vital, to take one example, that we try to stay one step ahead in our understanding of dementia. The number of cases is growing, because, let's face it, Oxfordshire and Buckinghamshire are getting older, along with the rest of England. Research is needed to help develop new therapies, new interventions, and perhaps new ways of preventing decline in brain health.